Welcome, everybody, to another episode of the Lost Coast podcast. Today's guest is Nellie Nakui, and she's the Regional Vice President with Impact Health Sharing. Welcome to the show, Nellie.
Thank you so much for having me. I'm honored and so humbled to be here. Thank you.
Now, this is great. This is a great thing you're doing for everybody here. I'm excited to do this piece with you. So let's just start off real quick on exactly what is Impact. What is it, the basic premises of it, and then we'll get into the nuts and bolts here in a second.
Great question. Well, Impact is a health sharing program, and health sharing has not been around. It's not new. It's been around for over 40 years. It started in churches. You had to be a certain religion, certain stipulations around what's covered, what's not covered. A few years ago, the government stepped in and changed the law from being religious based to ethic based. When that happened, floodgates open, as you can imagine, come one, come all. When that happened, largest health sharing organization, Metashare, their CEO stepped down and created the patent technology behind Impact Health Sharing. So Impact Health Sharing works, breathes, functions, feels better than health insurance. And essentially, it's an alternative to health insurance. So that, what I love is I just want to say, sorry to interrupt you, is that truly grateful and honored to be here because what I'd love to do is just I get the opportunity within your community to share a resource that people don't know exists because traditional health insurance is not their only option. So thank you.
Yeah, no, this is exciting here. And you're not new to this. This is impacting the first time you've been involved in the healthcare industry. I mean, give us a little bit about your backgrounds. I think that's a very key point so people can understand exactly what your mission is.
Thank you so much, Corey. Again, humbled. I had the opportunity within the last 16 years been in healthcare, truly found my passion in healthcare, done a ton of things in the healthcare space from pharmacy benefits management, broker, healthcare technology company, built a product end to end. But truly where I got my passion is I had the opportunity to lead clinical and behavioral health teams to transition our homeless population into housing to get them self-sufficient back into the community. My specialty was trauma-informed care, building care plans around what's happened to you versus what's wrong with you. But as you can imagine, definitely seeing how broken our healthcare system is from a different perspective. Both boots on the ground and high level suite, C-level suites. And that's truly where I found my fight to fight for humans to get the care that they need when they need it in a $4.6 trillion industry that's truly broken in the US, unfortunately. And, I was fighting health equity at a legislative level, and we finally found a solution. So, background, I can literally put anything next to impact, the conviction and passion. I had the opportunity myself. That's when I realized what we have here as I had as a business owner had traditional health insurance just for myself was paying over $650 a month at a $10,000 deductible. Basically catastrophic insurance, never had health issues, never had surgery, hoping I didn't have to use it, right? 87% of humans don't even meet their deductible, and they're basically paying cash when they go in to see the doctor, right? Because they don't meet their deductible, don't have health issues. The healthier paying for the 1% of the sick, right? And about 18 months ago, I got introduced to the opportunity, now paying $268 a month at a $2,500 deductible that we'll get into how it works too. But I had the opportunity to be on the patient end about a year ago with emergency surgery. Now, definitely wouldn't have called it an opportunity then, but I had appendicitis and ovarian cyst that had burst and internally bleeding, not fun. Hoag Hospital, Newport Beach, California. Not a bad place to go into the hospital if you're familiar with it, but that's when I saw how easy it was to use, but not just how easy it was to use, but when I got my bills, that's when I got excited. Now, no one gets excited when they see bills, but number one reason for bankruptcy is medical bills. And a lot of people are on the hope and pray plan. So when I saw those bills, I met with executives at Impact and got the opportunity to dig deeper and that's why I literally taught someone else how to do my business and do this 100% of the time because when you know of something, then you feel you have a responsibility. God forbid something happened to one of my loved ones and I didn't share it with them. So truly grateful to be able to share it within our communities, a resource that they don't know is available.
Yeah, no, the Impact's great. I mean, I'm a member. I have Impact. I carry Impact. I partnered with you now. We can offer Impact to everybody out there. Um, Tell us how Impact. We know it's different, but it's the same as what we call the health care industry, right? Where this is health sharing instead of the insurance world. Like you said, it's not new, but it's kind of coming out in a new way in the forefront here. Tell us kind of a side by side category of what somebody's looking at when they're now searching right now for health insurance.
I love that you said that. One, I heard you say health sharing. The difference between traditional health sharing, historically, because it's not a new concept. All we did is add technology, industry leading technology, transparency, to something that exists like Uber and taxis or hotel and Airbnb, right? All we did, we're revolutionizing the space by adding technology. Historically, health sharing, you had to go in as a cash patient, speak provider language, negotiate a rate, and pay up front, and then go back and get reimbursed. So a lot of legwork, right? And again, you had to be part of that religious, faith-based. Now it's come one, come all. And because of the technology, now everything, it works just like traditional health insurance. You're able to give the provider, choose a provider of your choice. That key, we have no network. Handcuffs are off. It's recognized as commercial insurance. You can choose your provider, and then you go into the provider's office, give your card just like you would any other health insurance card, and they call the number on the back of the card, bill the electronically, just like they would any other health insurance company. They would bill electronically the EDI payer ID number on the back of the card. Here's my card, if you can kind of see it there, just like a traditional health insurance card. And we actually do offer, Impact does offer a concierge service. So they'll reach out to your provider, provide provider education prior to going into the provider's office to your appointment, so that it's streamlined going in and out of that appointment. So that's kind of a side by side of traditional health sharing, but I'll talk about some of the differentiators between traditional health insurance and impact health sharing, if that's okay.
Yeah. One question though.
Yes.
So I go to the doctor right now. I go and have a bad experience with that doctor. The next time I want to go to a different doctor, it's okay, right? You don't have to stay with the one. You can change and go to wherever you want for your specific needs.
I love you touched on something so important. Absolutely. You can choose any doctor of your choice because it's recognized as commercial insurance. We don't have a network, and we take pride in the fact that we don't have a network. You can change anytime, don't need a referral from your primary, don't need a pre-approval, literally can go walk into any doctor's office. As I mentioned, I had an emergency, walked into Hoag Hospital in Newport Beach, California. So yes, to answer your question, absolutely. The freedom, healthcare providers are calling it healthcare freedom, truly.
Yeah, no, I think that's one of the key, most important components we need to make sure the listeners here are getting out of this is that you're not locked in anywhere. And the no referral thing that blew me away the other day when we had that meeting, blew me away. So I need to go get something fixed. I just go as I hear my insurance card. Let's book the appointment and get it done. It's really that
That's
simple.
seamless. That simple. It's truly, and it's now how insurance was intended. It shouldn't be difficult to get the healthcare that you need. And unfortunately, people are afraid of using the healthcare system because of what bill might show up later. So it's truly how the healthcare system was intended to be used. Freedom to be able to prevent a catastrophic event, not for catastrophic and a catastrophic event. So yes, the simple ease itself is huge. As we know, all of us are busy, right? And there's 24/7, 7 days a week, telehealth, MD Live, absolutely free. Convenience of your own phone or technology. You can see an actual doctor within minutes. So yeah, multiple ways to be able to really ease that access to healthcare. Again, as I mentioned, I was fighting health equity at a legislative level, had no idea we had a solution in our lap. And that's why I'm truly on this, I call it, we're on a movement in the health share and wealth share space. And truly, by sharing this within our communities is how we create that impact within our communities. So grateful to be here to be able to share it.
Yeah, no, this is like I say, great. I've used it already. You know, I thought it was going to be very difficult to go to providers around here and get an appointment, whatever. But I literally took that card in first time, just took it because I wanted to vet it myself before I started offering it, you know, to my clients and the people I know. I went in, handed them a card. They use that number on the back of the card, all taken care of. Everything's seamless. I mean, way more seamless than I know the other healthcare systems that I've been involved with, where I have to pay a big, fee to get into the office, and then they'll reimburse you. There's just all kinds of issues you always have with different situations. But it was virtually seamless, and I probably would have bet on it that it wasn't going to be that easy when I did it. So I was wrong, and I would have lost.
You know, Corey, I love that you mentioned that because that's what I truly hear is that, it's too good to be true. And those that have used it have even a gentleman that is a patient actually went into he had unfortunate experience on a bike and broke his shoulder, and he was thought, is this really how you say it could be used? He Googled the Seattle Seahawks doctor and went directly to them, no questions asked. So, I mean, that's one of many, many stories, but is truly, truly a differentiator in this space. And that's why I say we are literally at the forefront of revolutionizing healthcare with impact health sharing. And I know I have no doubt it'll be a common name. So very grateful to have this opportunity because everybody should know about it. It really has a ripple effect within our communities when we talk about the freedom of healthcare and access to healthcare without barriers in the way.
Yeah, and you see a lot of stuff. I know people right now they're going to want to Google this kind of stuff and look it all up, but really, it's the same. Like you say, you're going to be taken care of just like you would before, but even better because it's just that much simpler. And we're just going to throw it out there. The cost. Oh my gosh, when you start talking numbers on this is a no-brainer. No-brainer.
No brainer all the way around. As I mentioned, I was paying $650 a month. Now I pay $268 a month. But as you know, business owners are now in open enrollment. When you talk about an average of 50% less expensive than traditional healthcare, it's huge putting back as a cost recovery in not only business owners' pockets, but now employees have an option to opt in because they're not priced out. Business owners are seeing double-digit increases this year. I mean, it is a huge opportunity for those that are opting out because of their price out. Those that are healthy think they don't need it. They're on the hope and pray plan. God forbid something happens to them and they're stuck in a situation where, they don't have health care. Again, as I mentioned, number one reason for bankruptcy is medical bills. So truly, it is a differentiator in the space. The cost alone, when you talk about, I had someone, family of 8, that was paying $4,400 a month, now paying $607 a month. Average cost for impact health sharing, it anywhere from $73 a month for a single to a family at starting at $378 a month. It's only based on two things: the birthday of the oldest person in the household and how many people in that household, 1, 2, or 3 plus. So the premium doesn't change if a family has or a household has over 3 people in the household. So they'll have a huge savings. And then it depends on the PRA, what we call primary responsibility amount, synonymous to deductible. 2,500, 5,000, 7,500, and 10,000. Because of our algorithms, a very small margin between the 2,500 and 10,000. So just a huge differentiator when you think about business owners subsidizing their employees. And then it's not only, like I said, cost recovery back into the business owner's pocket, but now the employee gets a raise back in their check, and it's a lifestyle shift.
Yeah, works for everybody. Now, explain a little bit more on the employer. So if we got employers on here listening right now and you're like, this is sparking some interest, what's the process that a business owner needs to go through to that they're going to see and understand what's going on, how it works for them?
I love it. Super simple. I would love to put my contact information if possible. They contact me, but it's seamless. I work with business owners every day, enrolling them and their employees. You customize it however you want. We set up the group based on the employees that you want in the algorithms, the way that they work. It's the same cost individual versus a group because of our cost. And all we do is add the employees that wanted, because we don't have open enrollment. Now we're in open enrollment right now, but we don't have open enrollment. So you can add an employee anytime during the month and they become effective the first of the following month. And you customize on your end through payroll, however much you subsidize. There's businesses that do 50% of theirs and then they add their dependents and they pay for that. Huge savings, right? But it's customized however the business owner wants. And literally they can enroll today, their employees, and become effective the 1st of December. And they'll see huge savings. Now, bigger companies, some smaller companies would want just to have impact. I do recommend having both. Now they have an option. Maybe someone in a group specifically has, so we do have a 3-year pre-existing clause. I mean, we don't deny anybody. Let me repeat that. We don't deny anybody. It's the premiums are merely based on in birthday of the oldest person in the household and how many people in the household. So the algorithms, because of the algorithms, the cost doesn't change. It's merely about those two things and the deductible that they choose. But if you have a chronic treatment that you're going through or pre-existing, and we can talk about it if they reach out because of PHI reasons directly to me. And anything prior to 3 years doesn't even exist, like it was non-existent if you're free and clear of treatment. Now, treatment doesn't include just maintaining by a prescription because we have a pharmacy plan that's covered by. But in the last 3 years, if they're going through chronic treatment, it may not be a good fit. It is typically for the healthy or fairly healthy. However, that's why I always add it as an option to business owners so that there's an option for the employees to choose. For the healthy or fairly healthy. But it's super simple. Unlike traditional health insurance, we don't ask for documentation. It's a few self-reported questions that they have to answer, them and their household, and literally they become effective the first of the following month. They get the card within a few business days. I believe it's 7 to 14 business days, and they can use it or print their card from their dashboard. Now, unlike traditional health insurance or health sharing, you have because of our leading industry technology, that you have transparency to everything in your own personal dashboard, from your telehealth, your prescription. Always encourage people to put in their prescription. They can put in their address and actually see the cost difference of the wholesale cost. It may be cents difference, 5-mile radius. It may be hundreds of dollars difference. So I always encourage people to go on there. We have, at no added cost, we've also added dental and vision. A dental and vision discount program as of October 1st that you opt into in your dashboard. And it's not only medical comprehensive, it's also dental and vision added. We also have a brand new partnership where we should be headed in healthcare, preventative and wholeness credits. Up to $1,200 towards that family deductible, which is as low as $2,500 a year. $1,200 a year, that lowers it to potentially $1,300 for the whole family. Regardless of how many people in the family, what does preventative mean? Gym memberships, supplements, yoga classes, Pilates. One size doesn't fit all. Holistic, acupuncture, Reiki, red light therapy, stem cells. I mean, it truly is where we should be headed in healthcare, in that preventative and holistic space. We now have that opportunity. So huge differentiator in this space.
So with the business owners, like you said, excuse me, they kind of should have both in place, but just as an option for the employees.
I definitely recommend having both. That way you have that, if the option, if it's not a good fit, they may have some sort of chronic or pre-existing, they opt into the traditional, and then any healthy or fairly healthy, anything maintained by a medication, but anything fairly healthy or healthy would typically opt into Impact because of the huge cost savings, as you can imagine.
For the cost savings and, taking the handcuffs off you. You can go to whatever doctor
Literally.
you want. I mean, that's,
Freedom of healthcare,
yeah,
truly,
yeah,
truly.
you're not stuck with, you have to go here, you have to go there. These are your options. That's it. That's, to me, that's a key piece. I've seen it happen in my family already with the system where, oh yeah, this is where you got to go. You can't go to that doctor. If you go to that doctor, you got to pay out of pocket 100%. It's just, it makes no sense.
And I'll tell you, I'm just met with another business owner, 75% of his employees opted out because they were priced out. Imagine if something happened to one of those employees. They'd be out of employee, truly being able to give that option to employees so they're not on the hope and pray plan. God forbid something happened to them is a huge differentiator in the space. And it's small business owners, right? It's so expensive. Some can't afford to offer healthcare, but want to. And here's an option. We don't have restrictions or barriers around the percentage of employees or number of employees that have to opt in like traditional health insurance. Those barriers are gone. Even if one employee opts in, you can offer healthcare with Impact Health Sharing. What's the first thing that workforce asks when looking for employment? Do I have benefits? Do I have healthcare coverage? Now, employers, when looking for workforce, can offer healthcare coverage with Impact Health Sharing.
Yeah, no. And I don't mean to go back to the numbers, but let's talk about the family again real quick. So let's say it's a family of five, right? And they got the deductible of, I don't know, $2,500, right? What's the most that family's going to pay out of pocket then for the entire family?
Now it's based on the birthday of the oldest person in the household. If it's a family of five, if they chose the lowest or the highest deductible, like I said, the family started $378 a month. If the lowest deductible, depending on the age of the oldest person, I do have a one sheet reference that we can definitely look at for the business owners, just to even just to look at it side by side in a census of what they currently have compared to Impact. One things to look at, deductible, max out of pocket. But yeah, that premium itself, huge differentiator. The most, depending on age, that I've seen is $700. The most. An average, I just saw numbers yesterday, average of a family is by the JP, that was just published, JP Morgan Chase, is 1,700.
Man, now what about deductible? Let's talk a little bit about the deductible. If it's, that they got that, say it's a $10,000 deductible, the max one, right? Is that the max that's going to come out of that family's pocket no matter what happens to them throughout the year?
Great question. So we have four options, just like traditional health insurance, that you can choose from: 2,500, 5,000, 7,500, and 10,000. Once that deductible is met, then it's a 1090 share. What we call co-share, what traditional health insurance is called co-insurance. Traditional health insurance, it's a 30/70 or a 20/80. Ours is a 1090. So the differentiator here is traditional health insurance, you got to cough up that deductible first,
Right.
right? Basically paying cash. Now, Impact Health Sharing is a non-for-profit, so we don't have to pay dividends or investors. So what happens is the facility bills Impact. Impact then on the back end negotiates a lower rate, average of 72% savings. I've seen a lot higher too, but average is about 72% savings. And then it hits that deductible. So you see the reprice bill right away off the deductible. Let's say 2,500. They meet I always encourage, by the way, the 2,500. Why? Because of what happened to me. And it's a very small margin. For me, I think it was like $130 difference a month for $7,500 difference in the deductible. So I'm grateful that I chose, not thinking that anything would happen to me, that I chose the 2,500 myself. So I always encourage that, but you choose, obviously, based on your situation, what's best fit for you. But if you chose the 2,500, Once you meet that 2,500 after the repricing of the bill, then it's your co-share, 1090 share. So you only pay 10% of that bill, the repriced bill, up to a max of 5,000. So God forbid something happened to you or someone in your family, or somebody else in the same year, catastrophic, God forbid, the most you'd ever pay out of pocket is $7,500 for you and your family. Everything else is shared, given, of course, the pre-existing and whatnot, but everything else is shared within the community.
That's amazing. It's amazing. Yeah. So the business owners now, I don't mean to jump around, but things are going in my head because there's a lot of stuff going on here. The business owners now, I work for the business owner. They're going to offer me impact. I opted to impact. How does that now relate to my family? Can my family can they get on with the employer one? Or is it just, it's all separate anyways, like, because you can take it with you, correct?
Oh, great question. Taking it with you. So I think there was a couple questions in there, so I hope I answer all of them. One, yes, that's the other benefit is we don't, because it's health sharing and it goes with the employee. God forbid there, there's industries like service industry, for example, there's a turnover. They opt into impact health sharing, but it goes with them. We don't have to deal with COBRA, as expensive as those rates are as well, or any of that. It literally goes with them if they choose to continue that payment. Of course, that's between the employer and the individual who leaves that business. They can choose to take it with them, taking over that payment. Now, that's one. The other question I think I heard is, how does it affect the family? So depending on how, again, the employer can customize it however they like. So if they wanted to pay a subsidy of the individual and the dependents, that's up to the employer. However, and how I've seen it happen, for example, is the individual is paid for a certain subsidy, let's say 50%. They add their dependents on there, and the employer is able to take that amount, only pay the 50% of the individual, and then they add the rest of it. It comes out of their paycheck or however they customize it within their employer.
Well, perfect. So you guys can help them walk through that process, whatever they're looking for.
Oh, absolutely. It's streamlined directly through Impact. And when the group sets up, every individual employee gets an email, they get a welcome call. They have an opportunity to call to them directly with any questions. I mean, truly it's for the people, right? Think of a community, just like historically it was, there's just technology added. It's our communities coming together and being able to help each other in need. So everything that goes in is meant to be for the people in the community. So as I've been with Impact for the last 18 or so months, it's truly evolved. When I talk about, the wholeness and preventative care credit, the dental and vision, that's all evolving with time. So I know as we see, there's more things to come, hopefully, because as we're evolving with Impact Health Sharing, it's definitely only gotten better. So it's exciting to be able to share that, but also for business owners, you can customize, going back to your question, you can customize it however you like.
This is great. This is like the one all cure all kind of a piece right now, and we all wish that the rest of the healthcare insurance and all that would kind of take a lead on this too, and kind of follow a pack for just the benefit of our communities. I mean, why does it have to be so difficult to get help?
And that's why I say why I have open enrollment, right? Why should we have to wait to get health care? So it's a true, as I mentioned, fighting health equity at a legislative level. This is a true solution within our hands. So it's important that whoever does see this is able and takes the opportunity to share it within their communities, because it takes all of us. truly, as the best thing about it is it's new. The worst thing about it is it's new. So being at the forefront is truly the opportunity that we have today, and being able to share it. And again, I would love to personally share my contact information. I have a Calendly link, so schedule time to learn more information. It truly takes all of us to share it in the communities, because there's a ripple effect all the way up to at a legislative level, because when you think about access to healthcare, no barriers in the way, freedom of choice, I mean, it is truly being able to give that individual and our communities, people in our communities, a peace of mind to be able to get the care that they need when they need it, and not have the fear of who knows what may show up after I do get the care I need, what I need. I mean, it is truly, truly a differentiator in the space. And it does take all of us to share it. And I'm so grateful to be at the forefront. And if anybody has any questions, or if I'm able to share my information, I would love to do that so that we do get the word out there. I had that same question earlier today. Why haven't more people shared impact or know about impact? And it takes us, all of us. So it is exciting to be at the forefront and have freedom of healthcare and choice.
Yeah, we'll make sure we get your contact stuff in the show notes. So we'll make sure we get that from you and get it in there so we can start making the connections here and getting this all out to everybody. I mean, this is amazing. I mean, in today's world with the way inflation is, to save a few bucks now is very, very helpful. I mean, everybody's looking at a way to save a buck.
It makes a difference. It's a lifestyle shift, what we're putting back into people's pockets, both from a business owner, small business owner perspective, as well as employees. And I didn't mention a couple things. One, do want to mention that individuals without Social Security numbers can't even get healthcare coverage in the US. Now, if you have employees that have ITINs, that have documentation, we can offer healthcare coverage with impact. So imagine all the employees that are out there working with ITINs that don't have healthcare coverage. Now we can help them too. So just wanted to mention that, because it is a differentiator in the space. Is I have a lot of auto bodies, franchisee owners, help from the health and wellness, from the gym space. I mean, every business owner, broker, I mean, you name it, across the board, and just an opportunity to be able to share it, but are in the organization. But I've seen a lot of that be a huge differentiator as well.
Yeah. Awesome. Awesome. Well, Nellie, it was great having you on the show, but I want to make sure you get the last word and get the information out that you wanted. Is there any last things that you want everybody to know?
I think we covered it. It's a differentiator. The most important thing is being able to share it within our communities. As I continue to see it roll into different healthcare systems and it becoming a common name. So I'd love to, anybody to reach out, because I'd love to share within their communities.
Yep, absolutely.
Excuse
Well,
me.
with that being said, Nellie, we're going to bring this to a close then. And for our listeners out there, if this is spiking your interest, reach out either to Nellie, to me, however you got to make the connection, reach out to us. We're available. Nellie's contact information will be in the show notes. And this is the Lost Coast Podcast, and we're signing off. Thank you all for coming. Bye.